Hey friends, so here we are 6 weeks post-op. 6 weeks, 42 days, and things are going well. I wanted to give an update, as I'm trying to do at least weekly, but I wanted to show just a couple of the exercises that I'm doing. Not that I can show everything because I don't have equipment. Some of the stuff that they're using over there, obviously I don't have like a cycle in here. Not that you would need to see me do cycling anyway. But wanted to give an update, kind of where I am and how things are feeling and how things are doing. There's a progression from my ability to walk and move around and just do normal weight bearing stuff, including being able to shift weight side to side, being able to handle slight disturbances, like if I step on something slippery or if, I lose my balance for whatever reason. I'm not as hesitant about things now. I'm not, I guess I'm not as scared, really, to use my knee. There's still a lot of stuff that I can't do. There's still a lot of stuff I shouldn't be doing, like big twisting of my tibia, that kind of movement through that plane right now. I don't want to be excessive with it, definitely not be crazy with the forces there because things just haven't healed yet. It's going to take months and months before this is really stabilized as a new ACL properly. So in the meantime, I'm just trying to rebuild the strength and get a sense of general function without being excessive with things. The scar, I can actually kind of put my heel up just barely on the edge of my seat now without too much discomfort. It may look a little uneven right now in terms of the coloring. Kind of backwards here. Because, I've been working on it a lot. But you can see that the redness is really just on the scar. It's not spread out. It's no infection issue. It's not all inflamed. Little patches of it are kind of lumpy and irritated. Of course, we're doing massaging and all that just to kind of, I guess, encourage the tissue not to stick to adhere quite so much. 6 weeks post, a lot of the stuff that needed to solidify has solidified. But it's just one of those things. Plus, just touching it, manipulating the area. I don't want to say manipulating, not like we're cutting anything or physically adjusting tissue, but putting pressure or putting tension through the tissue, things like that, from a neurological standpoint, or getting me used to just having it touched and yanked on and moved around and giving me a good sense that this is part of my knee, this skin is healing and this tissue is getting stronger and is going to be fine. It's going to just be a functional patch of tissue in my knee. And of course, as we do the range of motion stuff, we continue being able to, just get it to move, make sure that, I'm not scared of it. It doesn't hurt so much that I'm worried about it. I'm supporting my leg right now, by the way, with my left hand. You can't see. It's just out of the frame, but I've been down here. Because I don't want to let it just dangle too much yet. I'm still not really... They're trying to get me not to let it just hang over the edge of a seat or a bed too much. But you can see how much flexion I have. So this is about 90. I'm here before I feel really any tension in the front. And I can go a few degrees past that. And now I feel tension kind of all throughout the top and the front of the knee. There's still swelling in here. There's still, some of that I got to deal with. But, we're getting there. I can extend concentrically. That range is a little bit more painful and a little bit more difficult, but I'm getting there. I've been sitting with my knees bent for a while. But if I kind of settle into this for a bit, I can now get it just to about 0 degrees. We measured today. I got my extension to about 0. It was kind of resting on the table at about 1 degree flexed, and then with a little quad contraction, I was able to get it down to about 0. It's not there right now because it does tend to stiffen up if I just sit, but there we are. With no exercises, no warm-up, no nothing, we measured my flexion today at 130 degrees, so I think that's pretty cool. So the range of motion is improving. That block I have in extension is starting to kind of relax, and I've been focusing a lot on letting my legs swing in a more relaxed way because when you're walking, or at least when I'm walking, my quad isn't locking my knee down as I extend to step. That's not normal. It's not natural for me. So I've been focusing on that, and I'll show you a couple other things I'm doing. Just move this out of the way. Yeah, that's good enough. So what I'm talking about is this. When I'm walking, and I think I showed this last time, if I step with my right leg, my right knee just kind of swings out into extension, right? It's a very natural kind of movement, and I can land on my heel. I'm not there yet with my left, but I'm focusing on letting just the momentum kind of carry my heel or carry my foot forward so the extension continues to happen. So I sometimes actually do a little bit of dangling as I'm just mimicking this motion. And I'm trying to step forward on my heel. You can tell I'm still landing with a little bit of a bend in my knee. It's not like my other one, but it is getting better and it's hurting less as I do it. The contact pressure between my tibia and my femur isn't hurting as much as it was before. As far as exercises go, one of the big ones we've been doing for a few weeks now. This is a light band. This is not as stiff as the one that I've been using. The ones I've been using in the clinic, but essentially we got this little motion here, or a series of motions, just basic stuff, and we do it on both sides. So on my stronger leg and on my surgical knee, right? Coming out to the side, just kind of doing pulses. And they do cue me about not leaning too much and all, even though I have to lean some because you have to shift your weight when you take your weight off of one leg. Out to the side, abduction, flexion, coming forward, extension, coming back, trying not to rock my body all over the place as I can. So I'm trying to grip the floor with my foot. Relearning how to do that's been kind of cool. And we do adduction as well, which is a little trickier because obviously there's a leg in the way, so you got to come forward and then come over and pulsing here. We do it on the other side and doing a couple of sets of these things. I've started doing squats, not full body weight squats or anything yet. I can do a body weight squat maybe about halfway, so from the side I'm about here. I'm not going to drop fast into it, but I can come down to, like, I don't really feel any pain to about here. Now it starts hurting a little bit. So I'm not all the way as deep as I would like to go, what I was able to do before, though because of my leg length versus my torso shortness, I was never, a butt on the heels kind of guy anyway. But there we are. I used to be able to get my thighs to about parallel typically, and of course I'd be folding up a lot. I'm not going to get into a big discussion about that. But what I've been doing at the clinic is going a little lower than I just went, but with some support in front. So we have TRX straps, so I just have a little bit of support, and it's keeping me more upright as well, but I'm doing a box squat. So imagine this is the box, I'm coming back and just kind of touching and coming back up. And I can practice these at home, since I'm not going quite as low here as I was at the clinic, and doing some of these. Also, I've been doing some bridges. I cleared off my bed here, so I just have this little kind of comforter thing at the bottom and my pillows. But what I'm doing over there, pardon my not very pretty room here. Let me move this over the other way. All right, let me go a little more. So I'm coming over here and doing, oh, that's another thing. I can actually kind of shift side to side a little bit more. I don't have to worry so much about spinning. I'm not pivoting hard on this leg, but spinning through space. So if I want to just kind of jump on my bed, I kind of can. And it's not a problem. So I'm coming over here, and I can just do normal bridges. Of course, this is squishier than the tables we use at the clinic. And I'm coming up, and just doing a normal bridge. Just squeezing my butt and coming up. I'm not elevating on a bench with my upper body. I'm just keeping my upper back and shoulders on the table. And they're actually giving me something like a ball to squeeze. I don't have that, but I've got, say, a couple of pillows or something. I could take those. Just giving me something to kind of squeeze between my legs here. I know they're kind of splaying out, but I squeeze these, come up, and there we are. From the side, same thing. Again, and I'm just doing sets of these. Trying to kind of hold at the top. And I've been playing around with my heel position, how far away from my butt my heels are. So I can bring them in a little tighter, come up, I can go a little farther away, different kind of challenges depending on where you are. I can also do it with just my heels, and that's a different challenge too. I feel a little more unstable. So it gives me stuff to work on. I'm also doing stretches. I don't have like a rope or a band or anything, but I've basically been doing stretches on this side with this hip, hamstring stretch kind of stuff, like pulling the leg back, right? So from the side, my wonderful tan here, just coming back. I'm coming over, which will be stretching kind of the outside of my hips, and then also coming out here, so stretching the adductors, right? I'm not going to give you a front-on view of that, but essentially, again, if I come here, so you can see, yeah, so this way, and this way. And it actually feels really nice because I wasn't able to do this for several weeks. And now that I am, it's just allowing movements and positions that I used to be very comfortable doing and I took for granted. That often is the case. When you're prohibited from doing certain things, you start to take those movements for granted. You start to take those positions, those abilities for granted. So I'm appreciating the opportunity now to start transitioning back into doing some of these things. I'm still avoiding certain stuff. So as I mentioned, I am still being careful about twisting of the tibia. I can do this, not a problem. But I'm being careful about doing too much of this while I'm loaded with a bunch of my weight on the knee. So I'm not even going to mime it. Like if I land on this knee and I'm pivoting, I want to be very careful about that. Let's see. Is there something else? I'm getting some of my medial quad back. Obviously, it's not going to be like this one. Not that I have titanic legs anyway, but you can see, and it actually crackles a little bit. I have some squishing in the joint, but I can easily get a lateral quad contraction. You see a little divot here, and then some medial quad stuff happening. And it feels pretty even, right? No big deal. My left quad, not the same. The lateral side has been engaging more or less for a while. Medial has been really hard to work on, but I am starting to get a little something. And you might be able to see, I can from down here, I'm actually kind of pushing my foot into the carpet right now. Like I'm trying to do a knee extension, but my foot's kind of fixed against by the friction on the floor. And I do get some activity here, mechanically speaking. That's just been starting to come back, say, the last week or so. So I'm really looking forward to being able to get all this stuff to start contracting in the way that I would like it to contract, and feeling, how that does as I regain more and more of this. It's going to be a while before this one looks like this one or feels like it, but we're getting there. Anyway, that's what we got right now. On Monday, today is Friday, the 16th of October. Well, in 3 days, I will be going back to see my surgeon. It's Dr. Crozier, Matthew Crozier at Austin Sports Medicine. And we'll be talking. He's going to look at this and kind of see how he feels about it. And also maybe discuss the procedures some more. And I think I mentioned in the previous video, clear up maybe some misconceptions I had about it. And we'll talk about a few things. So I hope I can get either some footage of that or at least report back to you guys after the fact about what I learned, what we discussed, how things are going. But I wanted to give an update. We're coming up on almost 15 minutes here, so I'm going to stop it. But I wanted to give the 6-week update of where I am. So thanks for watching, and I will catch you next time.